Ineffective breathing pattern is the inspiration and expiration that does not provide adequate ventilation. Ineffective breathing patterns are considered a state in which the rate, depth, timing, rhythm, or chest or abdominal wall excursion during inspiration, expiration, or both, do not maintain optimum ventilation for the individual. Respiratory failure may be associated with changes in respiratory rate, abdominal and thoracic patterns for inspiration and expiration, and in depth of ventilation. Breathing pattern changes may occur in a multitude of conditions such as heart failure, airway obstruction, respiratory infection, neuromuscular impairment, trauma or surgery, resulting in musculoskeletal impairment and pain, diaphragmatic paralysis, cognitive impairment and anxiety, metabolic abnormalities such as diabetic ketoacidosis, uremia, thyroid dysfunction, peritonitis, drug overdose, pleural inflammation, and chronic respiratory disorders such as asthma, or chronic obstructive pulmonary disease. Ineffective breathing pattern related to neuromuscular dysfunction, neurological immaturity, musculoskeletal impairment, bony or chest wall deformity, anxiety, pain, perception or cognitive impairment, decreased energy or fatigue, respiratory muscle fatigue, body position, obesity, hyperventilation, hypoventilation syndrome. Assessment, subjective data. Shortness of breath. Objective data. Dyspnea, orthopnea. Abnormal respiratory rate. Depth of breathing, adults tidal volume 500 ml at rest, infants 6 to 8 ml per kg. Timing ratio, prolonged expiration phases, pursed lip breathing. Decreased minute ventilation, vital capacity. Decreased inspiratory or expiratory pressure. Use of accessory muscles to breathe, assumption of three-point position. Altered chest excursion, paradoxical breathing patterns. Nasal flaring, grunting. Increased anterior-posterior diameter. Expected outcome. The patient maintains normal or effective breathing pattern. The patient is free from cyanosis and signs and symptoms of hypoxia. The patient's arterial blood gas values, within the normal or near normal range. The patient verbalize awareness of causative factors, and initiate needed lifestyle changes. The patient demonstrate appropriate coping behaviors.